I'm a retired Army officer. I retired in 1996 as a full colonel. I've been in combat situations, and I want to relate my experiences in helping veterans with PTSD and other people. So New York has a history of major trauma. And I just want to give you a sense of what it may be like. The recent evidence shows that you can give CBD as late as 5 hours after one of these events and prevent the brain from going into these inflammatory phases and into this dysfunctional phase, and start the process of rebalancing. So you avoid the major trauma. And that's also true for stroke, that you can stop that inflammatory process that's going on. So we have this system within our body, beyond the neurologic, beyond the immunologic, and beyond the endocrine system, that's really the master controller for all of these operations and doing subtle changes and maintaining normal. And that's the big issue here. In contrast to THC, what we see with CBD is an improved memory, improved speed of processing, and actually a neuroplasticity in terms of making new brain cells and making new pathways that can be restored, that need to be restored, and to provide for future learning and precision. There's also the anti-inflammatory and immune balance that goes into it in terms of balancing the number of macrophages or the inflammatory cells that are present within the brain, but at the same time reducing the number of cytokines, these inflammatory substances. And what's quite unique with CBD is it reduces the number of inflammatory cytokines, but it actually raises the level of the anti-inflammatory cytokines. Those are cytokines, interleukins 4 and 10, and they have these anti-inflammatory effects. So you're really getting a triple whammy in that process in terms of the cellular and the cytokines, the inflammatory, as well as the anti-inflammatory cytokines. I'm seeing a host of positive side benefits that are coming from cannabidiol. As a physician, I hear from lots of patients all the time. I've estimated I've spoken to at least 1,000 patients. And typically it's a phone communication, but they're asking questions like, will it control pain? Will it take care of anxiety? And will it take care of these other symptoms that I have that are quite disturbing? And I have to answer yes to all of those things because I see some extraordinary properties using cannabidiol in these situations. In terms of side effects, I'm not seeing anything. It's hard to imagine someone not needing CBD or using CBD. It has such healthy factors in improving your health and being all that you can be.